Hello everyone, in this video we are going to discuss about carpal tunnel syndrome. So what is carpal tunnel? Our wrist have a small space called as carpal tunnel, which is actually formed by the wrist bones on the sides and on the floor. That is, on the floor and on the sides they are formed by the carpal bones. Superiorly it is formed by the transverse carpal ligament. So it forms a tunnel. Inside this tunnel passes the flexor tendons and the median nerve. So whenever there is compression of the median nerve inside this tunnel, it is called as carpal tunnel syndrome. So what are the causes? The causes are repetitive wrist movements, hypothyroidism, pregnancy, diabetes, rheumatoid arthritis, acromegaly, gout, and end-stage renal disease. So why these causes carpal tunnel syndrome? In repetitive hand use, there is overuse of the wrist causing swelling of the tendons, and in pregnancy due to hormonal changes, fluid retention will be there and swelling inside the carpal tunnel will be there. And in hypothyroidism, there is mucopolysaccharide buildup and soft tissue swelling. And in diabetes, nerve becomes more vulnerable to compression because of the microvascular issues and diabetic neuropathy. And in rheumatoid arthritis, there is inflammation of the joint and tendon sheets leading to swelling in the tunnel. And also in cases of acromegaly, there is tissue overgrowth that narrows the tunnel. And in gout, there are deposits that, like toffee, the gout deposits, the uric acid deposits will be compressing the tunnel, leading to median nerve compression, causing carpal tunnel syndrome. So the symptoms are tingling, numbness in the thumb, index, middle and radial half of the ring finger, and these are worse at night. So these are the areas which is supplied with the median nerve. So these get tingling and the numbness sensation. This motor findings are weakness of thenar muscles, that is decrease in the thumb opposition and the abduction we will see, and sensory loss over the lateral 3.5 fingers on the palmar side. It spares the thenar remnant skin because it is supplied by palmar cutaneous branch which passes outside the tunnel. So it will not be compressed inside the tunnel, so the thenar remnant skin will be normal. The tests for this are Tinel's test and the Phalen's test. Tinel's test is nothing but tapping the carpal tunnel, on tapping the wrist at the flexor retinaculum, there will be tingling sensation. And Phalen's test is whenever we ask the patient to do wrist flexion, there will be symptoms like tingling and numbness in the on the lateral 3.5 fingers on the palmar side, and also we will see weakness. So this is these two are the tests. So this is the Phalen's test, that is wrist flexion there is compression of the median nerve causing the symptoms of the carpal tunnel syndrome, that is areas of numbness we will see on the lateral 3.5 fingers of the palmar side. This is Tinel's test, where whenever we tap with the finger on the flexor retinaculum on the wrist side, there is similar tingling sensation on the lateral 3.5 fingers. These two are the provocative tests for the carpal tunnel syndrome. Next, diagnosis is by clinical and nerve conduction studies. Treatment is wrist splinting and NSAIDs, and steroid injection and surgery for carpal tunnel release. So we can easily remember the symptoms by the mnemonic like tingling on repetitive motion, atrophy of the thenar muscles, Phalen and Tinel's test positive, sensation loss over 3.5 fingers. So traps is the mnemonic. Tingling, repetitive motion, atrophy of the thenar muscles, Phalen and Tinel test are the provocative tests which are positive, sensory loss over the lateral 3.5 fingers on the palmar side.